Welcome to Ask an Arizona Dentist. I'm Ted Simons. For many of us, a trip to the dentist is still something we tend to avoid, even more so in these challenging economic times. But proper dental care is vitally important to our overall health and well-being. Tonight, we'll hear from a panel of dentists about the best way to avoid problems and keep our teeth healthy and looking their best. Joining me tonight is Dr. Mark Hughes. He is president-elect of the Arizona Dental Association Board of Trustees and practices in Glendale. Also joining me is Dr. Brett Dameron and Dr. Allison House. Both are board members of the Central Arizona Dental Society and practice in Phoenix. Welcome all to Ask an Arizona Dentist. Specialists. In general, why is it important to get a specialist referred by your dentist?
Well, we have specialists in dentistry just like there are specialists in medicine. You wouldn't have your family physician perform your heart bypass. You would have someone with special training who only does that procedure. And it's the same thing in dentistry. We have specialists such as an endodontist, and an endodontist only does root canals. So if you're going to have something very complex, it's important that you have someone with extra training.
Is that how you see it as well? Because I think some folks think, I got a root canal, I got a this, that, and that. I'm just going to go to my dentist. Get it over with.
Well, and a lot of them prefer to come, you're comfortable with your family dentist, but it's like she said, you wouldn't have your family physician do heart surgery on you. And it's the same thing. Most of the specialists have anywhere from 2 to 5 years of additional training after dental school. They're very proficient in what they're doing, a lot more so than your general dentist. We kind of do a little bit of everything. That's all they do all day is that specialty, and it makes it a lot easier, especially for difficult cases.
List some of the things, the conditions that would prompt you to go ahead and send someone to a specialist.
Well, I think the most common is wisdom teeth. We'd send you to an oral surgeon. And again, it depends on the level of complexity. If something's going to be very straightforward and I'm comfortable, then I'm going to do it. But once you get to a certain difficulty level, you'd like that extra training. So wisdom teeth are a good example. Perhaps a very difficult root canal would go to an endodontist or a root canal specialist.
I don't enjoy doing root canals, so generally I send most root canals to a specialist. I do some braces in my practice. Some clear braces and conventional braces. But there are a lot of times when there are difficult cases where I would like to consult with a specialist who's had more training, and there are 3 or 4 guys in my area who are, I'm very comfortable calling up and asking them what they would do in this situation. And in a lot of cases, if I don't feel comfortable, I'll just send that patient over to those guys because I know they can handle that situation better than I could. And it's all about, what's best for the people, what's best for our patients. We want them to have the best care possible.